You notice a symptom and your brain jumps to two extremes. Either it's just a vitamin deficiency or it's something scary. The truth is usually in the middle, and the skill is knowing when to watch and when to act. Many deficiency symptoms are real, but they're also vague. Fatigue, dizziness, tingling, hair shedding, those can come from sleep, stress, infections, thyroid issues, blood loss, or medication side effects. So the goal isn't to self-diagnose. It's to spot patterns, and even more importantly, to recognize red flags that should not wait. In the next few minutes, you'll get a simple mental checklist. First, the red flag symptoms that deserve urgent care. Then, how deficiencies typically show up. And finally, how to talk to a clinician so you get the right tests, not just random supplements. If you only remember one thing, remember this: timing and severity matter as much as the symptom itself. Moving to slide 2. Let's start with the clearest don't wait category: sudden, severe, or fast worsening symptoms. Deficiencies usually develop gradually, over weeks to months, so if something hits hard out of nowhere, think beyond deficiency first. Examples include sudden chest pressure, trouble breathing, fainting, new confusion or weakness on one side of the body. A severe headache that peaks quickly is another one, so is new vision loss or trouble speaking. These can be signs of heart, lung, or neurologic emergencies, and time matters. Even if you also have a history of low iron or low B12, don't let that anchor your thinking. A deficiency can coexist with something urgent, but it rarely explains a dramatic change in minutes or hours. The practical rule is simple. If the symptom is new, intense, and escalating, treat it as urgent until proven otherwise. It's not about panic. It's about protecting your future options. Moving to slide 3. Next red flag bucket: bleeding, unexplained weight loss, or persistent fever. These are system signals that something bigger may be happening. If you're coughing up blood, vomiting blood, or seeing black, tarry stools, that's urgent. If you have heavy menstrual bleeding that suddenly worsens, that deserves prompt evaluation too, because it can drive iron deficiency, but also point to other issues. Unintentional weight loss, especially if it's noticeable over a few months without trying, shouldn't be brushed off as low vitamins. Persistent fever, night sweats, or swollen lymph nodes that don't settle can signal infection, inflammation, or other conditions that need a workup. Deficiencies can be downstream effects here, not the root cause. The key idea is direction of causality. Sometimes the deficiency is the clue that you're losing blood, not absorbing nutrients, or fighting a chronic illness. So if you have these systemic signs, think find the source, not pick a supplement. Moving to slide 4. Now let's talk about neurologic symptoms, because this is where people often assume a deficiency, especially B12 or magnesium. Tingling in hands and feet can be deficiency related, but the pattern matters. Red flags include new numbness on one side, loss of coordination, trouble walking, new bladder or bowel control problems, or severe back pain with leg weakness. Those can point to nerve compression or neurologic disease that needs urgent assessment. Another red flag is rapidly progressing weakness, especially if it affects breathing or swallowing. For B12 deficiency specifically, symptoms usually creep in: pins and needles, balance issues, memory fog over time. That slow build is a clue. Also, if tingling comes with chest pain, jaw pain, or shortness of breath, don't label it anxiety or electrolytes. Get checked. The takeaway is not that tingling is always dangerous. It's that the combination of symptoms and the speed of change tell you what lane you're in. Moving to slide 5. Let's shift to the deficiency-like symptom cluster, starting with fatigue. Fatigue is the #1 symptom people try to solve with supplements, and it's also one of the least specific. Iron deficiency, B12 deficiency, folate deficiency, and vitamin D deficiency can all be associated with tiredness, but so can sleep apnea, depression, chronic stress, thyroid disease, diabetes, infections, and overtraining. So instead of asking, which vitamin fixes fatigue, ask, what type of fatigue is this? Is it sleepiness, like you could doze off? Is it low stamina with exertion? Is it mental fog? Is it muscle heaviness? Then look for companions. Shortness of breath on stairs, pale skin, and restless legs can fit iron deficiency. Numbness and tongue soreness can fit B12. Bone aches can fit low vitamin D, though that's not exclusive. The point is to build a symptom profile. not chase a single label. Moving to slide 6. Here's a practical way to separate possible deficiency from something else: the timeline test. Deficiency symptoms often follow a story. Maybe your diet changed. You became vegetarian or vegan without planning protein and B12 sources. Maybe you had pregnancy, frequent blood donation, or heavy periods which can drain iron. Maybe you started acid-suppressing medication, had bariatric surgery, or have chronic diarrhea, which can affect absorption of B12, iron, and magnesium. Those are plausible pathways. On the other hand, if your lifestyle and diet haven't changed, and symptoms appear abruptly, the deficiency story is weaker. Also consider response over time. Deficiency symptoms tend to persist or slowly worsen until the underlying issue is corrected. They usually don't swing wildly day to day. Big fluctuations can suggest anxiety, blood sugar swings, migraine patterns, or medication effects. This isn't perfect, but it's a strong filter. Ask yourself what changed in the last 6 months. Often the cause is hiding there. Moving to slide 7. Let's get specific about iron deficiency and anemia, because it's common and often missed. Early iron deficiency can cause fatigue, poor exercise tolerance, headaches, and feeling cold. As it progresses to anemia, you might notice shortness of breath with activity, heart pounding, dizziness, or pale skin. Some people get cravings for ice or non-food items called pica. Restless legs can also show up. The red flag angle here is the why. In many adults, iron deficiency is not just about diet. It can be about blood loss, especially from heavy periods or the gastrointestinal tract. That's why new iron deficiency, especially in men or postmenopausal women, deserves a thorough evaluation. Another clue is chest pain or fainting with exertion. Those symptoms shouldn't be chalked up to low iron without medical assessment. Iron can be part of the picture, but you still want to understand the source and the severity. Moving to slide 8. Now B12 and folate, two nutrients tied to red blood cells and the nervous system. Low B12 can cause fatigue and anemia, but also neurologic symptoms like tingling, numbness, balance problems, and memory changes. One tricky part is that neurologic symptoms can happen even before anemia is obvious. Folate deficiency overlaps with fatigue and anemia, but it doesn't cause the same nerve damage pattern as B12. That's why clinicians often check both. Risk factors matter a lot here. Vegan diets without fortified foods or supplements can lead to low B12 over time. So can pernicious anemia, where the immune system affects absorption. And long-term issues with the stomach or small intestine can reduce absorption too. Red flags include worsening balance, frequent falls, or progressive numbness. Those deserve timely evaluation because nerve issues can become harder to reverse the longer they go on. The main takeaway is simple. Don't guess B12 from symptoms alone. Confirm it with appropriate testing. Moving to slide 9. Vitamin D is another big one, and it's often blamed for almost everything. Low vitamin D is common, especially with limited sun exposure, darker skin, or certain medical conditions. Symptoms can include muscle weakness, bone discomfort, and increased risk of falls in older adults. But here's the catch. Many people with low vitamin D feel completely fine, and many people who feel tired have normal levels. So vitamin D is a context nutrient, not a universal explanation. If you have bone pain plus frequent fractures, that's a different conversation and needs medical evaluation. Also, if you have chronic digestive symptoms, unexplained weight loss, or signs of malabsorption, low vitamin D could be a clue that you're not absorbing fat-soluble vitamins well. The red flag mindset here is to avoid over-attributing. Vitamin D can be part of a bigger pattern, but it's rarely the only answer. Testing and clinical context matter more than internet checklists. Moving to slide 10. Let's cover electrolytes and minerals, magnesium, potassium, sodium, and calcium, because cramps and palpitations make people nervous. Mild muscle cramps can come from exercise load, dehydration, or posture, not just minerals. But certain symptoms should raise urgency. Palpitations with dizziness, fainting, chest pain, or shortness of breath need prompt evaluation, because heart rhythm issues can be serious. Severe weakness, confusion, or seizures can also occur with major electrolyte disturbances. Those are not take a supplement and wait situations. Another common trap is oversupplementing. Too much potassium or calcium can be dangerous, especially with kidney disease or certain medications. The safer approach is to treat minerals as lab-guided, not vibe-guided. If cramps are persistent, if you're on diuretics, or if you have vomiting or diarrhea, it's reasonable to ask about electrolyte testing. The big idea is that minerals can matter, but the risk is in the extremes and in the combinations of symptoms. Moving to slide 11. Now, how do you actually talk to a clinician so you get clarity faster? Start with the three-part summary. What, how long, and what else? I've had fatigue for 3 months, it's worse with stairs, and I'm also getting dizziness and heavy periods. That's much more useful than I think I'm low in iron. Then add the key context: diet pattern, any recent bleeding, pregnancy history, GI symptoms, surgeries, and medications like metformin or acid suppressors. Ask targeted questions about testing. Depending on symptoms, that might include a complete blood count, ferritin and iron studies, B12 with confirmatory markers if needed, folate, thyroid tests, and sometimes inflammation markers. The goal isn't to demand a specific panel. It's to connect symptoms to plausible causes. Also ask, if these tests are normal, what's the next step? That keeps the process moving. You're not being difficult. You're being organized, and that helps everyone. Moving to slide 12. A quick word about self-treating with supplements, because it can blur the picture. If you start high-dose iron or B12 right before testing, labs can become harder to interpret, and some supplements can cause side effects that mimic illness, like nausea, constipation, diarrhea, jitteriness, or sleep disruption. Biotin is a classic example. It can interfere with certain lab tests, including some thyroid and cardiac markers, depending on the assay. Another issue is false reassurance. Symptoms may improve temporarily for reasons unrelated to the supplement, and the underlying cause keeps going. A safer approach is to document first. Write down symptoms, timing, triggers, and any risk factors. Then test before you treat when possible, especially if symptoms are significant or persistent. If you do supplement, keep it simple and tell your clinician exactly what and how much. The main goal is clean information, because clean information leads to the right next step. Moving to slide 13, let's pull everything together into a simple decision rule you can actually use. First, ask, is this sudden, severe, or rapidly worsening? If yes, treat it as urgent. Second, ask, are there systemic red flags like bleeding, persistent fever, night sweats, or unintentional weight loss? If yes, prioritize evaluation for root causes. Third, if symptoms are gradual and you have a plausible pathway, diet restriction, heavy periods, pregnancy, blood donation, GI issues, then deficiency becomes more likely, and targeted testing makes sense. Fourth, look for symptom clusters. Iron tends to pair fatigue with exertional breathlessness and dizziness. B12 tends to pair fatigue with tingling or balance changes. Vitamin D tends to be more muscle and bone-oriented. Finally, remember that more than one thing can be true. You can have low iron and thyroid disease. You can have anxiety and anemia. The goal is not certainty at home. It's the right level of urgency and the right questions. If this helped, subscribe for more practical health explainers. And for a quick check-in, comment with A or B. A, you tend to assume deficiency, or B, you tend to assume something serious. This information is not a substitute for medical advice.